First, Brittany, what are you doing? You look like you're daydreaming over there.
I am daydreaming. I was thinking about donuts.
Donuts, really?
Yeah.
Why?
Well, I was thinking about how the GI system, like our whole GI system, relates well to a donut.
Really? That's interesting.
Yeah.
What do you mean?
Well, conveniently enough, I have a diagram.
Wow, okay.
Yeah. So this here is my diagram of a donut, and as you can see, what passes right through the center of the donut never is actually a part of the donut. You know what I mean?
Right, just in through your mouth and out the other end, right?
Well, yeah, this is my other diagram of a person. So just like the same way, our GI tract acts as the donut hole. So whatever isn't absorbed by the stomach is never actually a part of our bodies.
Interesting. Yeah.
Yeah. So you can see why it's really important to have a strong intestinal lining.
Yeah, so we see a lot of patients here that have terrible GI problems. Like, have you heard of leaky gut?
Of course.
Yeah.
Yeah.
So the medical term really would be intestinal permeability, but for lay people, leaky gut really describes it well, don't you think?
Yeah, I would say so, because things leak through the
Right.
gut into the body and can cause things like inflammation is a big thing, right?
Mm-hmm. Yeah, so inflammation and maybe we should go back and just describe what leaky gut or intestinal permeability means. So, do you want to do that?
Sure, I need to brush up anyway.
Yeah. So the GI tract should be nice and intact. The lining should be nice and intact, but it can break down over time. And some things that break it down over time or increase stress. And we talk a lot about stress around here. So that's one reason that it's very good to get de-stressed, I guess. Alcohol we got little things here that show it can break the lining of the GI tract down. Too much ibuprofen. Antibiotics that you take for like illness or cold, that's another reason you don't want to take antibiotics unless you really, really need them. But also antibiotics in your food can also break down the lining because it kills off all the good friendly bacteria.
Lots of processed foods
too, yeah.
Like this.
Yeah.
Just not good for you.
And I see some big old white bread over there that you have. That's pretty processed. Yeah. So too much of that kind of stuff, not good nutrition. So between stress and the poor diet and ibuprofen and antibiotics, the gut lining can get broken down over time. So things that shouldn't be leaking out into the bloodstream do. So we get partially digested food proteins, or not food particles, but actually proteins that leak out into the bloodstream, and the body sees it as a foreign invader.
Yeah, attack.
Yeah. So the body goes on full alert, and that's where you get the inflammation from.
And some of the symptoms you can see, they're totally widespread, but things like food sensitivities, headaches, head to toe,
rashes, thyroid issues,
all kinds of stuff.
Yeah, so we don't know exactly why in one person, it would maybe cause a headache, and the next person it would cause some GI discomfort, but even depression, all of that can be part of this. So like she said, the symptoms can be just widespread, so it's very difficult to, I don't know why it affects different parts, but it does. We see different things in everybody.
But thankfully, there are some ways you can treat it, right? So some of the supplements we can do, glutamine, and how does this work?
So that is an amino acid, and that helps heal up the lining of the gut. But supporting, and you can even get this from eating good proteins and probiotics. Yeah, so probiotics are just good friendly bacteria, and that's where it starts to inoculate the gut with good friendly bacteria and starts to kill off the unfriendly bacteria that's there.
Digestive enzyme?
Yeah, and with digestive enzymes, so sometimes if you have leaky gut, you feel like you're not processing food well, or you might feel like it's just sitting in your gut, you feel a lot of gas. If you take the digestive enzymes with every meal, it makes a tremendous difference in helping break those foods down. So those are just supplements, but there's also a diet that we ask our patients to do when we're trying to identify some food sensitivities or
the anti-inflammatory diet or elimination diet, but that is a whole other video which we will definitely cover. Also decreasing that stress, which we've talked about with Polly, but I'm sure we'll cover more stress because that's huge. So yeah.
Yeah, so if you have any questions, you can email us, come in and be seen if you think you might be suffering from leaky gut or intestinal permeability, and we can certainly do some testing as well. That would be another video.
So we better stay away from those donuts to protect our own donuts.
That's right.
Right?
That's right.
All right.
That's right.
So
all right.
Join us next week. We'll be doing a new video, and have a great weekend.
Thanks.
Oh, don't forget to subscribe.
Your Hormone Helpers.
Your Hormone Helpers. Bye.